Good morning, everyone. My name is Kara Friesen. I'm the Associate Director of Health Services and Nationality Service Center. Thank you so much for joining us today to learn more about the upcoming changes to federal Medicaid eligibility and how they will be impacting refugees and other Office of Refugee Resettlement populations. Nationality Service Center is hosting this webinar as part of our work as a state grantee for the Office of Refugee Resettlement funded Refugee Health Promotion Technical Assistance work. Today's session will be led by Maripat Pileggi, Supervising Attorney at Community Legal Services of Philadelphia. And Maripat has been a trusted expert in public benefits programs and immigrant eligibility for many years, and she's answered many questions on behalf of those of us at NSC over the years, and we're very grateful that today she is willing to share her time and expertise on these important Medicaid updates with our partners across the state. We will have time for questions at the end of today's session, but if you want to put questions in the chat during the presentation, we'll make sure those are asked during the Q&A portion at the end, or you can ask them yourselves at the end of the Q&A session. And before Mary Pat gets started, I want to give one last reminder to take the short pre-survey before we begin. A link to that is in the chat. And with that, I will pass it over to Mary Pat. Thank you again.
Thanks, Kara. Hi, everyone. So glad to have you all join us today. I'm going to try to share my slides here. And I always have to do something to make this right. Does that look right?
Looks good.
Awesome. So, hello again, everyone. My name is Mary Pat. I am a lawyer at Community Legal Services in Philadelphia. I am going to do my best to explain to you all a really complicated subject today, which is immigrant access to medical assistance primarily, although we will touch on a couple of other public health insurance programs today. But like I said, it's a pretty complicated topic. If you think of a question after the presentation is over today, you can email me. This is my email address right here. Please feel free to email me if you have a question. If you have a client who needs our help, my email address definitely is not the best way to get community legal services help for an individual who needs our services. The best way for your clients to get our help at Community Legal Services is to send them through one of our intake processes. So for those of you who might not know us, we are a legal aid organization in Philadelphia. We provide free legal representation to low-income people in the city. We do medical assistance cases, which is what I'm going to talk about primarily today, but we do other stuff too. So if you have folks in the city who need our help, you can send them to us so they can ask for our help. For help with a medical assistance case, the way for folks to get our help, to get help from us, is a couple different ways. So we do in-person intake at my office here in North Philadelphia, 1410 West Erie Ave, on Tuesdays and Thursdays from 9 to 12. If people can't come in person, they can call us to do a phone intake on Mondays or Wednesdays from 9 to 12. We, of course, provide free professional interpretation for those who need it. So please let people know that we're available to folks in the city. If you happen to be working with folks outside of Philadelphia, there are legal aid programs that can help with medical assistance cases outside of the city too. I can help you figure out which program that is if you need that help. So that's a little bit about us. Now to get into what we're all here to talk about today. This is what we're going to talk about. I'm going to do an overview of some common immigration terms that are used in these health insurance programs that we'll be talking about today. Then we're going to get into a brief overview of medical assistance, what it is, who's eligible for it, then get into some more of the details about which immigration statuses make people eligible for medical assistance. Like I said, I will also do a brief overview of a couple of other health insurance programs, specifically CHIP and Penny, the health insurance marketplace. And then I do want to make sure we at least touch on this topic of Medicaid data sharing, medical assistance data sharing, which I know lots and lots of people are really worried about, and I'm getting a lot of questions about it. So I will go through what we know about that and what steps people can take to protect themselves. Like Kara said, we will save time at the end for questions, but you can feel free to put your questions in the chat as we go along. I won't see them as we go along. I'm really bad about seeing chat things while I'm presenting, but we will do our best to get to them. All right, let's get into it. So first overview of some immigration terms. Here are some common terms that you will hear being used in both medical assistance policy, but also CHIP, Marketplace, Medicare. All these terms tend to come up. Starting with refugees, I think you all know who they are, but just as an overview, these are folks who leave their home countries because they fear for their own life or safety in that country, and their government is either inflicting that harm upon them or cannot or will not protect them from it. They leave that country and then go through a whole lot of process outside of the US in order to get this refugee status before they even come to the country. And so once they get here, from the first day they arrive in the United States, they have this official refugee status in place. Asylum seekers, as you all probably know, the test for asylum is the same as it is for refugee status. The difference is that folks who seek asylum come to the US without that refugee status in place already. So they get here some other way, and then they ask for asylum. They submit an asylum application. Once they arrive, if those applications are approved, they become asylees at that time. Cuban Haitian entrant is a term that gets used a lot in these programs, and it's one that people get really confused about. Lots of folks who are citizens of either Cuba or Haiti and who are currently in the United States are Cuban Haitian or Haitian entrants. So a Cuban Haitian entrant is a citizen of Cuba or Haiti who presents themselves at a US border and have been permitted to enter. So usually that permission is a grant of parole. So they're granted parole to come into the US. If they've been granted parole, they remain a Cuban Haitian entrant even if the parole has expired. Even after that parole term expires, they remain a Cuban Haitian entrant as long as they are still here in the US. If they did not present themselves at a US border, they weren't paroled, but they are here and they have applied for asylum in the United States, then they also are a Cuban or Haitian entrant. And then even if they were granted parole, the parole's expired, they applied for asylum, asylum was denied, they remain a Cuban Haitian entrant up until the time that they have a final enforceable order of deportation. So that covers a lot of people. And I should say that the Cuban Haitian entrant status persists even if they have that person has moved on to some other status. So if somebody was paroled into the US, and then they applied for TPS, for example, and now they have TPS, that person might still be a Cuban, probably Haitian entrant if they have TPS, because the way they initially arrived was by presenting themselves at a US border and being paroled into the US. So a lot of folks out there who are probably Cuban Haitian entrants who might not know it. So, if you're working with Cuban Haitians, I think are more likely to be unaware that they are a Haitian entrant. So working with those folks a little bit to figure out how they entered, when they entered, what's happened in their immigration status or in their immigration case since they arrived could be really worth it, because as we will discuss later on, Cuban Haitian entrants pretty much have the same exact access to public benefits as US citizens. And certainly for all the programs we'll talk about today, they have the same access as US citizens. So a really important status to identify when you can. VAWA self-petitioners is the next term I have listed here. VAWA is the Violence Against Women Act. And one of the things that that law says is that if you are eligible for lawful permanent residency through a family relationship, so if you're married to a U.S. citizen or you're married to a lawful permanent resident and that person becomes abusive to you, you can separate from your abusive spouse and petition for your lawful permanent residency on your own, separate and apart from your abusive family member. Once you get that permission to do the lawful permanent residency application on your own, you become a VAWA self-petitioner. And that is an important status to identify because VAWA self-petitioners have some access to all the programs we'll talk about today. All right, moving on. U visas are available to victims of certain crimes. These folks often start their life in the United States as undocumented people, and then they are a victim of a crime, and then they are able to get a U visa, and then after a certain number of years with the U visa, they can become a lawful permanent resident. There are limits on how many U visas they will give out in a year, and I know that it's become very difficult to get a U visa, and even when you're approved, there can be a long wait to actually get the U visa in your hand. So at least at CLS, we don't see as many people with U visas as we used to, but of course, there are still folks out there with U visas. Temporary protected status is available to folks every once in a while. The Department of Homeland Security will designate some country as too dangerous to deport people back to. I'm sure you all know that the Trump administration is trying to end TPS designations for a number of countries, including Haiti. But for those countries that still have those TPS designations in place, folks who are here in the US from those countries can get this temporary protected status, immigration status, which protects them from deportation and allows them to get work authorization. And in some cases, allows them to access public health insurance programs, which we'll talk about today. Undocumented is a term we use for folks who either entered the US without inspection, or who came here with some status that allowed them to enter lawfully, but that status is now expired. Those are usually like temporary visas. Lawfully present is not an immigration status, but it's a term we use a lot in the public benefits context. And it's a term that is used within medical assistance law, CHIP law, Medicare law, a lot of different federal laws out there that define which immigrants can and cannot access the public benefit, use this term lawfully present. Sometimes it's called lawfully residing, but it means the same thing. It's just a term that refers to a very broad range of immigration statuses that allow people to be in the United States with permission, even if that permission is for a very short period of time. So people with visitors visas, for example, are lawfully present. For federal health benefit purposes, and when I say federal health benefits, I mean federal medical assistance and Medicare and marketplace subsidies and CHIP. For all of those federal health benefit purposes, the term lawfully present includes all the statuses we just discussed, except undocumented. So people with TPS, people with U visas, asylees, refugees, all those folks, they're all lawfully present. And it also includes some people we haven't talked about yet, including asylum applicants with work authorization. We did talk about asylum seekers, but if asylum seekers with work authorization are lawfully present, Kids generally do not have work authorization, so asylum applicant children whose asylum applications have been pending at least 180 days are also lawfully present. Green card applicants are lawfully present, and pretty much anybody who has a status that allows them to get work authorization is also going to be lawfully present. It's a very broad term, like I said, that is used to refer to a very broad range of immigration statuses that allow people to be here with permission, even if that permission is not, even if that permission has an end date. So that's a term to keep in mind as we continue on with our presentation today. It is used a lot. And then finally, lawful permanent residents. These are green card holders. You'll hear me today talk about lawful permanent residents, LPRs, green card holders, all the same thing. And people become eligible for green cards in a lot of different ways. Some people become eligible for green cards through family relationships. Other people start off their immigration journey here in the US with some other status that puts them on a path to green card eligibility. Some examples of those folks are refugees, asylees, special immigrants from Iraq and Afghanistan, people with U visas, people with T visas. So all of those folks have a status that puts them on a path to potential future green card eligibility. And that is also something that's really important to keep in mind as we continue the presentation today, because soon enough, having a green card will make a big difference soon in which healthcare programs people will be able to access. And we'll talk more about that as we continue with the presentation. So that concludes my rundown of some common immigration terms. I know that there are lots of other immigration statuses and other terms that come up in these programs, but I did my best to try to hit all the main ones before we launch into some more detail about what those immigration statuses mean in terms of people's access to benefits. It can be hard to figure out what somebody's status is. You know, as you all know, immigration processes are long and complicated, and sometimes people start out their immigration process understanding what they're applying for and what's going to happen next, but things get so complicated that sometimes people lose their way and they don't quite understand what's going on with their case. These can be really frightening processes for a lot of people. And so just the fear alone can make it hard for people to understand. And of course, none of it makes any intuitive sense to begin with. So, you know, it's hard for, you know, us as lawyers sometimes to figure out what an immigration status is and who has what. So you do often have to start from the beginning with folks, give them some context about why you're asking these questions. And then, you know, on this slide, probably the most important point is don't send somebody down to the local USCIS office to figure it out there. Connect people with immigration legal services if you really need help to figure out what somebody's immigration status is. There are some documents that can help you figure it out. This is a list of some of the common ones, and I have some examples here in case you haven't seen these yet. These are some iterations of the green card, the lawful permanent residency card. There's also the work authorization card. People with green cards don't have a work authorization card because the green card is their work authorization card. But each one of these cards has some important information on it, including the USCIS number, which is also the A number or the alien registration number, and a category code. The A number or USCIS number is important because it's what the county assistance office uses to verify that somebody has the immigration status that they attest to having. So the county assistance office will need that A number in order to complete somebody's immigration status verification process. The category code is important because if you look it up, it'll tell you what this person's underlying immigration status is. So it'll tell you what this specimen test V, what his immigration status is that made him eligible for work authorization. And that's really what you want to know. You want to know what this person's immigration status is so that you can figure out what kind of health insurance program he might be able to get. This is a naturalization certificate, which people get after they become U.S. citizens. It has that USCIS number on it again. This is an I-94, which on the left is an electronic I-94, on the right is a paper I-94, and it tells you why this person was allowed to enter the US and for how long they were allowed to enter. So, for each of these folks, both on the left and the right, their admission date is long in the past. So if nothing else has happened in either one of these people's immigration cases since that admit until date, then probably these folks are undocumented at this point, right? So these I-94s can give you these some information about when people were last admitted into the U.S. and why they were admitted and for how long. You can check out some of these websites if you don't know about them. If you need some help to figure out what somebody's immigration status is, these sites can help. All right. All right, so that's a little bit about immigration status. Moving on to medical assistance eligibility. These first few slides are a very brief overview of all the medical assistance programs that we have in Pennsylvania, just to give you some context of what we're talking about here. So medical assistance is the same thing as Medicaid. It all means the same thing. It's the public health insurance program for low-income people administered by the State Department of Human Services through the county assistance offices. These are all the different cards on the bottom of this slide. These are all the different cards that a medical assistance recipient in Philadelphia might have. Everybody should have an access card, which are the cards over there on the left, and then almost everybody else will be enrolled in managed care, which are the 5 logos here on the right side. These 5 managed care organizations are the 5 that serve southeastern Pennsylvania, so our part of the state. So if you're working with somebody with one of these cards, you're probably working with somebody who has or recently had medical assistance. There is one medical assistance program in the state of Pennsylvania, but that one program has 2 funding sources. And this is important because the immigration status eligibility criteria change depending on funding source of the medical assistance program you're trying to access. So these two funding sources are federal funding and state funding. The federally funded MA programs go to the people that federal law define as eligible. The federal MA programs have higher income limits, so we like them because it's available to more people within a higher range of income levels. But the federal MA programs have restrictive immigrant eligibility criteria, so we don't like them so much because of the restrictions they put on immigrant access. Emergency MA is a subset of federal MA, and it is only available to those people who do not meet the federal MA immigration status eligibility criteria, including undocumented people. Undocumented people do not meet any of the immigrant eligibility criteria for any of the programs we're going to talk about today, including federal MA. So in order to get EMA, you have to have an emergency medical condition. And if you have an emergency medical condition, you will have EMA, federally funded EMA, to provide coverage of the treatment of your emergency medical condition. Then we have state-funded MA. These are medical assistance programs that are 100%ed with 100% funded with state dollars. So because this is only state money, it's only state law that applies. So it goes to people that state law defines as eligible. These programs have very low income and asset limits, so we don't like them so much because the income limits are so low and therefore available to people at only the lower end of the income spectrum. But we do like them because they have less restrictive immigrant eligibility criteria than federal MA. Though state-funded MA is still unavailable to undocumented people. So that's kind of the brief overview. We're going to get into a little more detail about all of that in the next few slides. These are the federally funded MA programs. They hopefully are a little familiar to you. I've listed them here from the highest income limit programs to the lowest income limit programs. At the top, we have the breast and cervical cancer prevention and treatment program. After that, we have waiver programs or home and community-based service programs. These are community health choices programs also now in the state of Pennsylvania. These are available to people who need nursing facility level of care. After that, we have MAUD, which is the Medical Assistance for Workers with Disabilities program. This is for people who are disabled under age 65 and working. After that, we have a program for lower income Medicare enrollees. These are buy-in programs, we usually refer to them as. This is a Medicaid program that just pays for people's Medicare premiums. After that, we have Healthy Horizons. That's available to people over age 65 or people who are disabled at least 12 months. Then we have kids, pregnant people, and the expansion population. The expansion population are adults under age 65 who don't have Medicare. We refer to them as the expansion population because they are the folks who became eligible for the first time when the Affordable Care Act expanded Medicaid eligibility back in 2010. Those kids, pregnant people, expansion population, we refer to them as MAGI Medicaid because they use modified adjusted gross income and household composition rules. So that it's related to taxes is what you need to know for that. So all the rules about who's in your household and how much income counts is derived from tax rules for those three groups of people. And then at the very bottom there, we have SSI recipients and TANF recipients. If you get SSI or TANF cash assistance, you are automatically eligible for federally funded MA. All right, so that's a brief overview of the federally funded MA programs. The state-funded MA programs are available to people age 59 or older, parents of kids under 21, people who are disabled, people caring for unrelated children or disabled household members, people in drug or alcohol rehab, and then domestic violence victims. I've listed this also in terms of like higher income limits at the top, lower income limits at the bottom. You might be thinking, what are you talking about? What's the income limit? Well, this is what I'm talking about. So the income limits, as I said, for state-funded MA are very, very low. You'll see over on the left-hand side in red, the state-funded MA programs have income limits of no more than about 40% of the federal poverty line. While the federal MA programs over here on the right side of this slide have much higher income limits. The lowest income limit is 100% of the federal poverty line, and then it goes all the way up to 250% of the federal poverty line. Some of these programs also have asset limits, some of them do not. So hopefully this helps you to see just how much more generous the federal MA programs are in terms of financial eligibility criteria. These are actual numbers. If you're interested in actual numbers here, this is a wonderful chart created by the AISLAW project. I'm happy to share it with you all if you'd like it. It has all of these different 2026 numbers on it. For these different income limits, you'll see that the three highlighted boxes here for 100% of the federal poverty line, 138% of the federal poverty line, and 250% of the federal poverty line. These are kind of the big three programs that most people on federal MA will fall into. Um, and what isn't highlighted here are the state-funded MA numbers, which are all the way over at the top and on the left-hand side, the GA/TANF related and the MNO income limits. And you'll see here in real numbers just how low those income limits are for state-funded MA. So for a single person, we're talking about no more than $425 a month for state-funded MA income limits. All right. So those are the medical assistance programs we're talking about here. Keep that distinction between federal MA and state-funded MA in your mind if you can, because as I said, the immigration status eligibility criteria are different for the federal MA and the state MA categories. So we're going to start here with the federal MA category. So that's the higher income limit categories in purple through green in that chart I showed you earlier. So in order to get into one of those federal MA programs today, a non-US citizen will have to have one of the immigration statuses listed on these next couple slides. So starting with refugees and others with kind of refugee-like statuses. So what I mean by that are people with asylum, Cuban Haitian entrants, T visa holders or trafficking victims, people with withholding of deportation or withholding of removal, special immigrants from Iraq and Afghanistan, and then people who were paroled into the US from Afghanistan after the US military withdrawal there in July 2021, or from Ukraine after the Russian invasion in February 2022. Those folks are eligible for medical assistance to the same extent as refugees until their parole expires. And I know that for a lot of those people, their parole has now expired. If you do not have one of those refugee or refugee-like statuses, you might still be able to get federal MA if you are a VAWA petitioner or a green card holder for 5 or more years, or if you've been a VAWA petitioner or a green card holder for less than 5 years, and you are exempt from what we call the 5-year bar. People who are exempt from the 5-year bar include kids under 21 or pregnant adults, people who have been continuously present in the US since August 22nd, 1996. We don't see a whole lot of those folks so much anymore, but every once in a while one pops up. Or people in the US military or with US military experience. And then, even if you are not a VAWA petitioner or a green card holder, you might still be eligible for federal MA if you are a child or a pregnant adult who is lawfully present. There's that term that I asked you to keep in mind. Lawfully present is a broad range of immigration statuses. So any kid or pregnant adult with pretty much any status that allows them to be in the US, even if they are only allowed to be in the US for a temporary period of time, they are lawfully present, probably, and can get federal MA. The immigrants who are left, those folks who cannot get federal MA because of their immigration status, include green card holders who have had their green cards for less than 5 years and who are not exempt from the 5-year bar. Remember that refugees and refugee-like statuses are never subject to the 5-year bar, even if they have had their green card for less than 5 years. So somebody who entered the US as a refugee and just got their green card last year, even though they've only had their green card for 1 year, they are not subject to the 5-year bar because they're a refugee, and refugees are exempt from the 5-year bar. VAWA petitioners who have been VAWA petitioners for less than 5 years and who are not exempt from the 5-year bar also do not meet federal MA immigration status They also will not meet the federal MA immigration status requirements. And of course, undocumented folks also will not meet federal MA immigration status requirements. So everybody on this slide has an immigration status that is going to make them ineligible for federal MA. All of those higher income federal MA programs will be off limits to them because of what their immigration status is. So for all of these folks on this slide, EMA or state-funded MA is going to be their option. So here are all the statuses we talked about today. These are the folks who are eligible for federal MA. These are the folks who are not eligible for federal MA, except EMA. EMA is an option for all of the folks on this bubble to the right. And then for some of the folks in that bubble to the right, they also have state MA as an option available to them. So this is complicated. People get this wrong a lot. People at the county assistance office get this wrong a lot, which is why I tried to make a picture to try to just, some people learn visually, right? And so hopefully this helps you just kind of visualize like who we're talking about, how these divisions are made, and how, especially for this bubble on the right, for the people ineligible for federal MA, there's this layering of kind of two programs on top of each other for a lot of folks of both EMA and state MA as available options. All right. So for those folks in that bubble on the right who cannot get federal MA because of their immigration status, they have these two programs, state MA and EMA. There are a lot of ways in which they are different. There are a lot of ways in which they are alike. State MA offers people a full package of medical assistance benefits. They have the same access to medical assistance benefits as people enrolled in federal MA programs. EMA, on the other hand, only provides medical assistance benefits as needed to treat the emergency medical condition. So it's a more limited access to benefits. Process. In order to get state MA, it's a regular application process and renewal process. So people submit the same application, they do the same renewal application that people in all other MA programs do. For EMA, it is a regular application. You submit the same application form and the same renewal form, but you also have to, on top of all that, prove that you have an emergency medical condition. Duration, state MA is authorized for a full year of eligibility. EMA, the eligibility approval is just for the duration of the emergency medical condition. So if the emergency medical condition is only going to last a few months, you will only have EMA for a few months. Delivery of benefits, both state MA and EMA folks are access card only. They are not enrolled in managed care. They are on a fee-for-service payment delivery method. So the state pays their medical providers directly. It does not go through a managed care organization. And then finally, the financial tests are very different because keep in mind that those red state-funded MA programs have much lower income limits than the purple through green federal MA programs, which have much higher income limits. All right, so that's a little bit of a compare and contrast for these two programs. These next few slides talk a lot about emergency medical assistance. This is a very difficult program to use. I know people struggle with it. So I wanted to talk with you all a little bit about it and what it means. So the key with emergency medical assistance is, what is an emergency medical condition? Do I have an emergency medical condition? How long will the emergency medical condition last? That is really the key in these cases. And there isn't a whole lot that the law tells us about what an emergency medical condition is. This is it. This slide is the definition of emergency medical condition, copied and pasted straight from the law. I added the color, of course, but the words come straight from federal law. And really what we need to do as advocates is figure out what this definition means in the state of Pennsylvania, because each state has some level of discretion when interpreting this definition and figuring out which conditions meet this definition and which do not. So I highlighted here with some color the parts of this definition that I think are most useful to pay attention to as we're thinking through these questions. First, a medical condition that manifests with acute symptoms. So the key here is that the condition itself does not need to be acute. The symptoms have to be acute. So an underlying chronic or ongoing condition can be an emergency medical condition as long as it manifests with acute symptoms. I like seizure disorders as an example of this potentially. People with seizure disorders have seizure disorders for a very long time, sometimes their whole life, right? So there's no doubt that it's an ongoing, maybe even chronic condition. But the seizure, nobody disputes that a seizure is not an acute symptom. So a seizure disorder is an ongoing chronic condition that manifests with an acute symptom of a seizure, and therefore might be an emergency medical condition. Those seizures might come and go over time. You never know when a seizure is going to come. You never know when it's going to go. And so the key here is you do not have to be currently experiencing that acute symptom in order to have an emergency medical condition. You just have to have a condition that does, we know, manifest with an acute symptom. And a seizure disorder is a good example of that kind of condition. Severe pain. So a medical condition that manifests with acute symptoms of sufficient severity, including severe pain. Severe pain is the only thing explicitly identified in this definition as a qualifying acute symptom. And I think it's important to pay attention to because a lot of people have a lot of pain, right? So if you're working with somebody whose condition includes a high degree of pain, you might be working with somebody who has an emergency medical condition. All right. Such that, moving back to the definition. So a medical condition that manifests with acute symptoms of sufficient severity, including severe pain, such that the absence of immediate medical attention. Medical attention is a broad term. It could include anything. It could include medicine that you pick up at the pharmacy once a month. It could mean a doctor's visit where you get an exam from a doctor or a nurse practitioner. It could mean lab work. It could mean surgery. Sometimes it even includes nursing facility care or rehabilitation. Medical attention is a very broad term, and you should think of it broadly. What you need, though, is an immediate need for it. But keep in mind that just because you need it right away doesn't mean that it's immediately accessible to you, right? The ERs do not provide rehabilitation, right, services, right? So you might need rehabilitation right away, but you can't get it right away by going to the ER. So needing something that is not available at the emergency room or even at a hospital does not mean that you don't have an emergency medical condition. There was a lot of negatives, right? The point here is you do not have to be in need of something that's available at the emergency room in order to have an emergency medical condition. The setting at which your medical attention is provided or needed can be a variety of settings: inpatient, outpatient, pharmacy, doctor's office. All right. You need to have an immediate medical need for immediate medical attention, and without which you have this reasonable expectation of a result that is a serious health consequence. This is a future-looking test, like so could reasonably be expected to result in. This is a future-looking test. You do not currently need to be experiencing the most serious consequence of your health condition in order to have an emergency medical condition. You have to have a doctor or a medical provider that has a good faith medical opinion that something serious is going to happen to you if you don't get medical attention quickly. And then finally, the thing that your doctor expects to happen to you does not need to be death. Any serious dysfunction of a bodily function or part, or any other serious consequence to your health is enough, right? Even if the thing that's going to be seriously dysfunctional is not essential to your life, like an arm or a leg or an eye. Your arms and your legs and your eyes are still bodily organs or parts, and they count for this. So those are just some tips as you're thinking through these cases about what might be a good EMA case and what might not be. Keep those things in mind. In Pennsylvania, I think we can still, with some confidence, say that emergency medical assistance is authorized to cover cancer and surgical procedures and dialysis and repair of broken bones and high-risk pregnancy. Medications like anti-rejection medications for people who have had organ transplants, anti-seizure medications for people who have seizure disorders, insulin for people who have insulin-dependent diabetes. Labor and delivery is always an emergency medical condition. And there are others. Proving emergency medical conditions can be tough. There is a form, the PA 1917, but the Department of Human Services, the County Assistance Office, will often ask for more, including medical records or detailed statements from providers about why the condition is an emergency medical condition and how long it is expected to last. This is the 1917, if you haven't seen it. There is policy on how that 1917 should be used that most people do not know about. So actually, if I could just flip back to the 1917 for a second, you'll see that there are all these boxes that doctors can choose to check. These boxes A through L. So if the doctor does A through K, if the doctor chooses A through K, then the county assistance office might be able to approve EMA really quickly without any additional review. But if the doctor chooses box L, then the case needs to be sent to a group of doctors to review to decide whether EMA will be approved or not. So those boxes A through K include all of the conditions listed here. So high-risk pregnancy, diabetic emergencies, renal failure requiring dialysis, fracture of a bone, unstable seizure disorder, ventilator dependency, labor and delivery, and acute inpatient psychiatric hospitalization. If the doctor checks off those boxes A through K for any of those conditions, and the doctor lists treatment dates that match the right side of this chart here. So 9 months for high-risk pregnancy, going down to 1 month for acute inpatient psychiatric hospitalization. If the doctor does both of those things, then the county assistance office can approve EMA right away without any additional review. But if the doctor does something else, if they choose box A through K and they don't list a treatment duration that matches that last slide, or if they check off box L for some other treatment, then the county assistance office has to send the case off to this group of doctors in Harrisburg for medical review, for the doctors to decide whether there's an emergency medical condition or not. And if there is an emergency medical condition, the doctors also choose how long that condition will last. That can be a really tough process. That group of doctors in Harrisburg often denies cases, or they approve cases, but for a shorter amount of time than the doctor has listed on the 1917. So those can be really tough cases. And doctors, and I'm saying doctors, but I should say it's doctors, nurse practitioners, physician's assistants, psychologists. There are a larger group of medical providers who can do the form than just doctors. but medical providers of all sorts have a lot of questions about the 1917, and one of the big questions is like, how long should I put as the duration of time that this person's going to need treatment? Because oftentimes people need treatment for a long time. So I don't have a perfect answer to that question, but I do have two pieces of information that I often do provide to medical providers when they ask me about this. So two notes on selecting treatment dates. The first is, and this is purely anecdotal, but in my experience, it seems to me that this group of doctors in Harrisburg do not like to approve EMA for anything more than 6 months at a time. So if they get a 1917 that says, the emergency medical condition is going to last for 3 years or something, they almost always will shorten it to 6 months or less. Right, 6 months seems to be the maximum amount, unless it's a high risk pregnancy, in which case 9 months is the obvious choice. So that's one piece of information. They don't like to approve for more than 6 months at a time, it seems. And then the second piece of information I can give people is that EMA approvals of 2 months or more are approved as quote unquote ongoing EMA. And that's important because ongoing EMA comes with many more procedural protections against termination. What do I mean by that? What's a procedural protection against termination? Well, the first thing is they're not allowed to cut EMA off until they give the EMA recipient an opportunity to prove that their emergency medical condition is going to last longer. So there's this built-in review process with ongoing EMA, where people have to get a notice from the county assistance office that says, hey, your EMA is about to be closed. If you think it shouldn't be closed, give us some more information about why you think your emergency medical condition is going to last longer. And then second thing that ongoing EMA recipients get is they get an advance notice to terminate. So after they get that opportunity to provide additional documentation, if that process fails, they don't turn in documentation, or the county assistance office doesn't like the documentation that they turned in, then that person's EMA cannot be cut off until they're sent an advance notice to terminate. And that's really important because an advance notice to terminate comes with the right to appeal while keeping your EMA on active while the appeal is pending. So that's something that ongoing EMA recipients get that non-ongoing EMA recipients do not get. So if you have an approval of EMA at the beginning that's less than 2 months, you don't get an advance notice to terminate. You don't get this additional opportunity to prove that your emergency medical condition is going to continue. You just get a one notice that says you're on and then you're off, and that's it. So no right to appeal and to keep benefits going while the appeal is pending if you get one of these shorter approvals. All that to say, it seems to me that somewhere between 2 months and 1 day and 6 months is kind of the sweet spot when we're thinking about how long an emergency medical condition might last. All right. Appeal. I just mentioned the word appeal for the first time. These are really, really important. They're always important in these medical assistance cases. They're about to become a whole lot more important because medical assistance is about to become a lot harder for everyone, especially immigrants. And appeals are the first line of defense that people have to preserve their rights to benefits. So appeal, appeal, appeal. Our motto is appeal now, think later. There almost always is a reason to appeal, but if it turns out that your appeal is meritless, you can always just withdraw it, and nobody will care. So appeal. If you are appealing, if you're getting a medical assistance cutoff notice, you appeal it within 15 days, you get to keep your benefits on while the appeal is pending. If you miss that deadline, you get a total of 30 days to file your appeal. You can come to us. If you're in Philadelphia, you can come to us to ask for help with an appeal. because the appeal deadlines are so short, we really do encourage people to just file the appeal first, get it in so you don't miss the deadline, and then come to us after. All right. All right, here are those bubbles again. I put them up here again to show you that this is about to get a lot harder. HR1, sometimes called the One Big Beautiful Bill Act, this terrible reconciliation bill that passed in July, is going to restrict access to medical assistance a whole lot. So if you remember these bubbles from before, that bubble on the left is now a lot smaller. Starting October 1st, 2026, the number of immigration statuses that are going to give people access to federal MA will shrink a whole lot. And which means the bubbles on the right get a lot bigger. So there will be many more people for whom their only federal MA option will be EMA. And then also a much bigger group of people who will have state MA as an option. So the group here in the middle that are kind of faded, the refugees, asylees, T visas, special immigrants from Iraq and Afghanistan, VAWA petitioners 5+ years, and withholding of removal. These are all people who are currently eligible for federal MA, but who will become ineligible starting October 2026. We are paying special attention to this group of people here in the red circle, because these folks might have a green card, right? And if they have a green card, then they will remain eligible after October 1st, 2026. But if they don't, then they will be stuck over here in this bubble on the right, where their only options will be either state MA or EMA. We are also paying a lot of attention to EMA these days because HR1 reduces the amount of federal money that is available to the state of Pennsylvania to pay for EMA. HR1 does not change eligibility for EMA at all. It just reduces the amount of money that's available to the state to pay for it. So we are afraid that the state will make some changes to the EMA program to save itself money. We're also paying attention to the state MA program because now it's a much bigger program, right? This red bubble is a lot bigger now, starting October 2026. It's a lot bigger in October than it is now, which means there will be a whole lot more people who need it, which means the state might be on the hook for a lot more state dollars. So again, we're afraid that the state might take some action to reduce access to state MA. We're paying really in order to save itself money. Not because HR1 changed state MA, just because the effect of HR1 is that the state might be on the hook for a whole lot more money in it through a state MA program. So we're paying very close attention to what the state is doing with both of those programs, both EMA and state MA, to make sure that they stay at least as accessible as they are today. All right. CHIP is a program that's available to kids through age 19 in families whose income is too high for MA. It is free for families up to 200% of the federal poverty line. And then there are premiums for families with higher incomes. Keep in mind PH95. PH95 is the name of a medical assistance program for kids with disabilities. The thing that makes this program special is that only the child's income counts. And most kids don't have income, right? So if you're working with a kid with disabilities in a family whose income is over the kind of traditional medical assistance income limit for kids, remember PH95 as an option for them to keep them in medical assistance rather than moving them to CHIP. You got to be lawfully present to get CHIP. There is no public health insurance option for undocumented children in Pennsylvania. Undocumented kids are in the same boat as undocumented adults, which is EMA is their only option. CHIP is unchanged by HR1. So there are no changes to CHIP. The CHIP will remain accessible to lawfully present children, just like medical assistance will remain accessible to lawfully present children after HR 1 takes effect in October 2026. HR 1 only changes medical assistance access for non-pregnant adults. Penny is an option for higher income adults. This is available to lawfully present adults who are ineligible for federal MA, either because their income is too high or because of their immigration status, or both. Penny is Pennsylvania's health insurance marketplace. Some people still call it Obamacare or ACA. It's all the same. There are subsidies available to help people pay for premiums, copays, and deductibles. I know those subsidies are much less generous now than they have been in the recent past, but they are still there. HR 1 does make two major changes to immigrant access to penny subsidies. The first started this past January. Starting January 1, 2026, you must be over 100% of the federal poverty line. So I have an example here of how this might play out. A non-pregnant work authorized asylum applicant making $1,000 a month, which would put her at about 80% of the federal poverty line. She was able to purchase insurance with subsidies in 2025, but starting in January, she would not be able to purchase Penny with subsidies unless her income goes up to at least $1,330 a month, which is 100% FPL in 2026. So her income, she might be too poor to access Penny subsidies, which of course is absurd. But that is the change that happened starting this past January, and then it will get more restrictive in this coming January 1st, 2027. Starting then, immigrant access to Penny subsidies will shrink to those same immigration statuses that we saw in medical assistance. So green card holder, Cuban Haitian entrant, or COFA migrant. I haven't mentioned COFA migrant really. COFA migrants are citizens of Micronesia, Palau, and the Marshall Islands. I don't know that we have a COFA community in Pennsylvania. I keep waiting for somebody to tell me that we do. As far as I can tell, these folks live primarily in Hawaii, and then there are some communities kind of scattered around the U.S., mostly around the western coast of the continental U.S. But I'm not sure if there are COFA migrants in Pennsylvania, so let me know if there are. I think in Pennsylvania, it'll just be green card holders and Cuban Haitian entrants starting January 1, 2027. All right, so that's Penny. So I mentioned HR 1, One Big Beautiful Bill Act. I really hate calling it that, so I just call it HR 1 all the time. Quick overview. I've mentioned all of these changes that HR 1 brings to immigrant access already, but I thought it would be useful to put it all on one slide. So starting this past January, Penny subsidy access was restricted by income. You must now be over 100% of the federal poverty line in order to access them. That is an immigrant access restriction because only immigrants under 100% of federal poverty line had access to Penny before January 1, 2026. So by creating this new income floor, they've cut off a bunch of immigrants from Penny access, low-income immigrants from Penny access. Starting October 1, 2026, federal MA access will be restricted for non-pregnant adults. Only green card holders, Cuban Haitian entrants, and COFA migrants will have access. What this means, this is just non-pregnant adults, right? So federal MA and CHIP access for kids under 21 and pregnant adults through 12 months postpartum is not changing. HR 1 does not touch federal MA or CHIP access for those groups. HR 1 also makes no changes to Refugee MA. Refugee MA will still be available during those first 4 months with that refugee or refugee-like status, regardless of whether that person has LPR status during those 4 months. Most people, of course, will not have LPR status during those first 4 months. Also, starting October 1, 2026, we see this reduced federal funding for EMA. And then starting January 1st, 2027, penny subsidy access will be restricted to green card holders, Cuban Haitian entrants, and COFA migrants. I haven't mentioned Medicare during this presentation, but Medicare access is also restricted to those same three groups of immigrants, green card holders, Cuban Haitian entrants, and COFA. This is very, very grim. This is terrible, and it will be a very, very difficult time for a lot of people as we move through this next year plus. Okay, so moving from one grim topic to the next, like I said at the top, I wanted to just spend a few minutes, about 5 minutes before we get to questions, on MA data sharing, Medicaid data sharing. I know this is a big concern for a lot of people. I've been getting a lot of questions about it. So wanted to share the little bit that I can, what I know about it. So two federal agencies, actually, both USDA, which administers the food stamps program, and HHS, which administers the Medicaid program, have made recent efforts to collect large amounts of public benefit data from states and/or have shared state public benefit data with the Department of Homeland Security, specifically for immigration enforcement purposes. In addition to administering Medicaid, HHS also administers CHIP, TANF, and LIHEAP. There have been some attempts to stop these data collections and data shares. Some of those attempts have put temporary holds on the data collections and data shares. These are lawsuits, and all of those lawsuits continue. So we don't know what the final result of any of those lawsuits will be. We do know, though, that HHS has publicly announced that it is sharing Medicaid data with Department of Homeland Security and ICE specifically for immigration enforcement purposes. They made that public announcement in November. So I feel very strongly that data sharing that is happening between HHS and ICE is unlawful. And there are, like I said, lawsuits that raise those claims to say that this is unlawful. Nevertheless, because we know this is happening, whether it's legal or not, we do unfortunately have to let our immigrant clients know that there is some risk for them if they are applying for benefits for the first time, and these are risks that they should consider when they're deciding whether or not to apply for public benefits. So I have a few things on these next few slides that I've been talking to people about. The first is, just very clearly, if you apply for public benefits, you're going to put your information down on that public benefit application, and a lot of the information that is in that application will be made available to the federal government, because the benefits that people apply for, federal MA and food stamps and CHIP and TANF and LIHEAP, all of those are federal benefits. And so the federal government has access to the information that people put on their federal benefit applications. And that will always include people's names and address, right? So that's the first piece of information. Second piece of information, if you're already getting one of those public benefits, Medicaid, CHIP, SNAP, food stamps, LIHEAP, TANF, taking yourself off of that public benefit program is not going to take your information out of the records that the federal government already has, right? So withdrawing from public benefits that you're already receiving does not reduce your risk that ICE will get the information in your public benefit record. So if you're getting public benefits, you should probably just keep getting them. If the Department of Homeland Security already has your address, probably through your immigration case, then putting your address on a public benefits application probably is not going to put you at any additional risk, right? So for example, if you've applied for asylum and you put your address on that asylum application, the Department of Homeland Security already knows your address, right? So putting your address again on a Medicaid application is not going to put you at any additional risk that ICE will be able to find your address. They already know what your address is. So applying for Medicaid, at least now you can, have that risk, which is admittedly very scary that ICE now has your address and can find you. But maybe if you have Medicaid, that might help you deal with that risk and deal with your health while you're also living through this very scary time where ICE may be able to find you. All right. Public benefit programs are very helpful and important, right? I, as a lawyer, cannot tell somebody you can't apply for public benefits. You shouldn't apply for public benefits. All I can tell you is what I know about the risks associated with applying for public benefits for the first time. These are decisions that people have to make for themselves, right? For some people, getting Medicaid is going to be more important than, or the benefit of Medicaid is going to outweigh the risk of potentially having that Medicaid application used by ICE. Last, if you're not applying for yourself and you're only applying for other people in your household, you don't have to put anything on your public benefit application about your immigration status. You can skip over the social security number question. So for example, if you're an undocumented mom and you want to apply for Medicaid for your kids, you don't have to put any information on that Medicaid application about what your own immigration status is. You can skip over the social security number for yourself, and you can just list the information, the social security number and the US citizenship information about your kids, and that's it. The application itself does tell people this. This is the PA 600. This is the Medicaid application that most people use. So this information is in the application. It tells people that they don't have to provide this information if they're not applying for themselves, but it doesn't do a very good job of telling people that, so people miss it a lot. So this is the PA 600 from the first page that people fill out. And right here in small print, it says that providing an SSN is optional for people who are not applying for benefits. And then on this page of the PA 600, it asks if you're applying for yourself. If you check no, then that means that you can skip over all of these questions at the bottom about what your immigration status is. All right. Here are some resources that might be helpful to you all as you think about these cases. At the top is our intake flyer, including a bunch of translations if you want to tell people how they can get in touch with us. The Protecting Immigrant Families Coalition is a wonderful group. They put out a lot of helpful resources, including this one-pager on that Medicaid data sharing issue that we talked about. And it's also translated into a bunch of different languages. All of the rules that we talked about who's eligible for medical assistance and CHIP and refugee MA and how people verify immigration status and how their information is protected and who needs to provide a social security number and who doesn't. All of those rules are in Pennsylvania DHS's handbooks, which are publicly available to all of you. Not always the easiest to read through. So if you're poking around in any of these handbooks and you have some questions or you're looking for a specific rule and you can't find it, that could be something that you email me about. I've been poking around in these handbooks for a long time. So I can help you find what you're looking for if you need it. All right. Do we have questions?
Very quickly, before we go into questions, I am going to end the recording now. So if folks feel free to ask without worrying about being recording, I'll conclude our session now. But thank you, Mary Pat, for all you've shared. It's been really, really helpful.